Hello everyone, this is Dr.M.S Balakrishna, Professor and Head, Department of Maxillofacial Surgery, Malabar Dental College. Practical exams for a final year student and especially in oral maxillofacial surgery is a cumbersome process. You have to prepare the patient as well as on the day the patient should come, you will be scrutinized. So it is very important to know the basics of practical exams and on which parameters you will be assessed by the externals. To begin with, first and foremost, you should choose a patient with a tooth which you want to that you are comfortable in. That means the nerve block what you are going to give, either PSA nerve block or inferior alveolar nerve block, whichever you are comfortable, that tooth you choose for an extraction. It is mandatory to have an IOPA, a perfect IOPA, and there should be, if possible, an adjacent tooth also should be there in the X-rays. So, on the day of examination, first and foremost, you should come around 30 minutes early. You and your patients both should be having a very good breakfast and there should not be any tension at all. You should arrange all your preclinical records, your seminar books, your logbook, and everything what you need to produce during the examination. So once you are in your examination center, 30 minutes prior, settle down. And then when the examination starts, you have to start with a case history. A detailed case history is very important and it is actually your first interaction with the examiner will be the case history and the chase side viva. So your first impression should be the best impression. So your case history when you are starting, your chief complaint should be very precise and it should be very relevant to the patient. Then coming to the history of presenting illness or the present illness, there you have to write in a chronological order. That means how the problem started and how it is right now in a chronological order. You should describe the type of pain also, whether it is stabbing pain, pricking pain, reversible, whatever the different types of pain, you need to address that. And then your past dental history, especially from a surgery point of view, is very important. It gives an indication that whether the patient had any allergy in his previous extraction or not, or whether was there any episode of syncope or any medical conditions arose or not in his past history. So that is very important, past dental history. Then when you come for physical examination, you should check all the vital parameters, the lymph node palpation if it is involved, you should do that. Respiratory rate you need to check, so all those things. And when you take the medical history, that is a place where most of the examiners will catch students. So you should be very clear, even if your patient is not medically compromised, you should know in and out regarding the medical histories. So first and foremost, when you deal with cardiovascular system, most of the patients may be having endocarditis. So 6 months it should be deferred. The extraction should be deferred at least 6 months. So that point you should be telling. Externals will ask you, if at all this patient have this problem, what is your line of treatment? So like that, medical history you should emphasize. If a patient is taking Ecosprin, what is the line of management? If he is taking 75 mg, you can straight away go with extraction. But 100 mg or more, then you need to take a physician consult. Please understand, never say that we stop the patient 5 days or 7 days not to take the medications. We as a dentist should not tell that a physician consult is required. Same way, if the patient is diabetic, what are his diabetic values, and then if his neuro problems are there, kidney problems are there, so those areas they will stress more. And you should know that medications, what drugs are indicated, contraindicated this particular medical conditions. So most probably you will be giving antibiotic, painkillers, so which are indicated, which are not indicated, you should be knowing that. Your professional diagnosis is again all based on your case history. And then with your investigations, what all you advised, then you come to a definitive diagnosis. That is extremely important. because you will be judged whether you can diagnose a problem or not. And then once your diagnosis is confirmed and you present the case history to the external examiner, then they will say, okay, go ahead with the treatment. Then you should write the treatment plan. Treatment plan is not only extraction of the teeth, but followed by a prosthesis also should be written in your case sheets. Then the medications, what are you planning to give, those also should be written there. So this is the first aspect, that is your case history. Then once the case is approved, then the external or the internal will tell you to go ahead with your extraction. So then that time the sterilization protocols comes into play. How you arrange the instruments, that is very important. So you should put a green cloth, and then you should first place the diagnostic instruments, then your elevators or elevation instruments, then your forceps, dental elevators, and then suturing instruments, then betadine or saline, you can put it in a bowl. So everything what is required for an extraction should be there in your kidney tray or in your dental chair. It should be available. You should change the tumbler, glass, and you should check everything. Once the patient is seated, you will put that drape, and the painting also can be done on the particular site with betadine. And then with topical anesthesia you apply. Before that, you have to wait for the examiner and take the permission before wearing the gloves. So that is very important, because some examiners want to check how do you wear the gloves, whether you really know. And scrubbing also, some examiners will tell you, I would like to see how do you scrub. So your different methods of scrubbing also, you should be knowing that. Then coming to, once you do the block, maybe an internal may come and check the block, the landmarks you should follow, and then a proper time you should wait, 2 to 3 minutes to 5 minutes you should wait, let the LA act, keep talking to the patient. And the very important thing what examiners note is, once you have given the LA, whether you have, during that act, whether aspiration was done or not. They will not be telling anything, they will not be talking anything, but whether the aspiration was done or not, how do you cap the needle. So those few basic things which you are taught in your departments will be checked. And then your chair positions, how you are doing it. While extraction, your chair positions, height of the chair, where you are standing in which quadrant, your forceps selection, and then your finger rest and finger guard, are you doing it or not, post-operative instructions, and then your medications they will check. So basically your chair side viva will deal with local anesthesia, extraction, and your pharmacology, your medicines and all, it will deal with that. Then after this, you will switch on to the next round of examination, that will be your spotters. Okay, so coming to the spotters. So in your spotters, variety of instruments will be kept, starting from your diagnostic instruments, your forceps, your suturing instruments, and medical emergency drugs, and some major surgical instruments also will be kept. So you should be able to identify it, hold it in correct anatomical position, the way you will extract in the correct position, and then you should at least tell 2 points regarding the same. So these are the instruments most commonly displayed in your departments. Forceps and elevators. So those were the basic forceps and elevators. So coming to, first and foremost, you should know what is this instrument. This is called cheatal forceps. With this only you will be grasping all the instruments. So you have got your Rose disimpaction forceps, Bristow's elevator, Ferguson mouth gag, then your Langenbach's retractors, and your reverse Langenbach retractors are there. And then you should know little bit of osteotome, chisel. So those instruments also you should be knowing, chisel and mallet. And your, depends upon if your college, if they are showing the fracture instruments and all, you should use that also, like screws and all. So coming to medical emergency drugs, because medical emergency can occur anytime. So you should be aware of the basic emergency drugs. The list is here. So at least this injections you should know which is given IM, which is given IV, and why it is given for indications you should be aware of. So coming to the emergency drugs, first and foremost, to begin with, you have a local anesthesia bottle, which you know that. So you have got atropine, you have got adrenaline injections, you have got lorazepam, and you have got vitamin B12. So this basic things you should be aware of. And then you should be all about the cannulas also. That IMIV cannulas what we give, that also you should be knowing it. Little bit about ringer lactate solution, your NaCl, your saline. So basic the parenteral fluid also you should be aware of. Now I will be discussing about how you should prepare for a Viva. See, Viva is a act that or examination assessment that your overall capability will be checked up, right? How you understand the subject, how much reasoning you know, and how much application knowledge you have. So to begin with, first and foremost, you should know everything about local anesthesia. In local anesthesia, they will ask the theories of local anesthesia, the complications of local anesthesia, and the blocks. But most of the local anesthesia would have been covered in the chairside Viva itself. Exodontia, you should know in and out, absolute and relative contraindications. And then the spotters, forceps are kept, that also you should be able to identify. Next, about impactions, you should know the borderlines, the assessment, predecessors difficulty index, and the complications. TMJ, you should know Kaban's protocol at any cost. And then the ankylosis, the classification, you should be knowing it. Medical emergency drugs, very important, you cannot afford to miss this, you should be knowing that. And then coming to your cyst, the management of cyst, Waldron's technique, parts 1, parts 2, that you should be knowing. Ameloblastoma, tumors classification, parts 1, parts 2, and marsupialization, your resection, those things you should be knowing it. Then your neck dissections also, your TNM staging, you should be aware of those things. Coming to fractures, a simple classification, and basically the question what they will try to ask is, what do you mean by favorable and unfavorable fractures? And what are the different X-rays through which you will know that? So, and various steps in the fracture management, that is your primary care and trauma, open reduction, closed reductions, indications, what do you mean by compression plates, what is decompression plates, so all those things will be asked. Regarding implants, you should be aware of the classification and what are the implant materials and the procedure in brief. And then coming to your pre-prosthetic surgery, you should be knowing about the Dean's alveoloplasty and then the various vestibuloplasty procedures, that is the theoretical question, and the bone grafting methods also you should be knowing that. And then coming to your some so-called small topics like trigeminal neuralgia, you should be knowing it. And the most important is you would have given some 4 to 6 seminars in your department. Those seminar topics you should be well versed. If nothing is working well, your seminar topics will help you. And the examination paper, the question paper, what you would have written it, that paper, all the 16 questions, whatever your university tells that, so that those questions will be, you should be knowing in and out. So it is always better to prepare 4 or 5 years question papers along with your seminars and the overview of everything you should be knowing it. It is not that you should know 100% in one area. You should know 1% in 100 areas. That is an undergraduate Viva. So hope this basic tips will help you for your forthcoming practical exams. All the very best.